Welcome back to the deep dive. Today, we're really getting into a fascinating set of source materials you sent over.
Mm-hmm.
We're looking at, well, your body's security system, the immune system, and also that vital outer layer, your skin.
That's right.
But also, crucially, what happens when that system gets, well, confused?
Mm.
Allergies, autoimmune stuff.
Exactly. It's a deep dive into how that internal defense system, talks to your external shield, the skin.
Yeah.
We want to unpack the main ideas from these documents you shared.
Highlight the key bits.
Yeah, connect the dots so you walk away feeling like you've got a really solid handle on it all.
Okay, let's dive in then. At its absolute core, what is the immune system trying to do? Like, job number one.
Its main goal really is protection, protecting you from anything it sees as foreign or not self.
So viruses, bacteria.
Viruses, bacteria, parasites, fungi, yeah. Even your own cells, if they've gone wrong, like cancer cells. It's this constant surveillance network, always patrolling, identifying threats, figuring out how to neutralize them.
And the sources you provided break this massive system down into two main arms, is that right?
That's a good way to put it. Two main branches. First, you've got innate immunity.
Innate, okay.
Think of this as your body's immediate sort of general defense crew, the first responders on the scene.
Right, the ones that get there fast.
Super fast,
Right.
kicks in within minutes to hours. But the key thing here is that it's non-specific. It attacks pretty broadly anything that looks foreign.
Okay.
And crucially, it has no memory. It reacts the same way every single time it encounters that particular threat.
Gotcha. So who are the main players in this fast kind of general response? What do the sources highlight?
Well, first you have the physical barriers, skin, mucous membranes, which, we'll circle back to skin later.
Right.
But inside, cell-wise, you've got some key players. Macrophages, they're like the big eaters, gobbling up pathogens and junk.
Okay.
Neutrophils, they're super common white blood cells, often the first ones to rush towards bacterial infections. Then you have natural killer cells, or NK cells. Pretty amazing. They target cells infected with viruses or even some tumor cells without needing prior instruction.
Wow.
And then, really important, dendritic cells. Think of them as scouts. They grab the invaders, break them down, and then present little pieces of them to the next level of defense. They're the link.
Ah, okay, the link to the adaptive system.
Yeah.
This is where it gets more specialized.
Much more sophisticated, yeah. Adaptive immunity is your body's learned defense. It takes longer to get going the first time, days, not minutes.
Okay.
But it's incredibly precise. It targets a specific invader. And here's the really cool part. It develops memory.
Memory. That sounds important.
Hugely important. First time it sees a virus, the response is slower. But the second time, because it remembers, the response is way faster, much stronger, much more effective. That's the whole idea behind vaccines, basically.
Right, like creating a most wanted poster and a specialized task force for every single bad guy it meets.
That's a perfect analogy, yeah. The main cells doing this work are the lymphocytes. You've got B cells, which grow up, mature in the bone marrow.
B cells.
Their big job is making antibodies. You know those Y-shaped proteins? They circulate in your blood, other fluids, acting like guided missiles targeting specific invaders. That's called humoral immunity.
And the other main type of lymphocyte.
That would be the T cells. They mature in a little gland called the thymus.
T cells. Thymus. Got it.
T cells handle what's called cell-mediated immunity. They often interact directly with other cells. The sources mention a few key types.
Okay.
You've got helper T cells, kind of the coaches organizing the whole response. Cytotoxic T cells, they're the killers that destroy infected or abnormal cells directly.
Direct action.
And then very importantly, regulatory T cells. These guys are like the peacekeepers. They actually help stop the immune system from attacking your own body. They put the brakes on.
Crucial. Okay, you mentioned antibodies from B cells. The sources listed different kinds. Are there any we really need to focus on for today?
Definitely. There are several types. Immunoglobulins, or Ig, like IgA, that's for long-term immunity. IgA is important in mucous membranes, like in your gut or lungs. IgM is often the first one made in a new infection.
Okay.
But the one to really flag, especially for later, is IgE. It's usually in low amounts, but it plays this central, often problematic role in allergies.
IgE.
Yeah.
Got it. Okay. So we have this incredible multi-layered defense, the fast general innate crew, and the slower, smarter memory-building adaptive special forces. You've got macrophages, neutrophils, T cells, B cells, churning out antibodies like IgE. What happens when this amazing system messes up, gets confused, Misidentify something.
Yeah, that's exactly where things can go wrong. It leads to conditions like hypersensitivity reactions, allergies fall under this category, and autoimmune disorders.
Hypersensitivity. Sounds like overreacting.
That's pretty much it. The immune system goes overboard. The sources mention 4 types, but type I is the one we usually think of as an immediate allergic reaction, and it ties right back to that IgE antibody we just talked about.
So type I hypersensitivity is basically the allergy mechanism we experience.
Fundamentally, yes. It starts when you're exposed to an allergen, something usually harmless, right? Pollen, dust mites, cat dander, peanuts.
Things that shouldn't cause a problem.
Exactly. But in someone who's susceptible, their immune system mistakenly flags it as dangerous and makes a whole load of IgE antibodies just for that specific allergen.
Oh, yeah?
These IgE antibodies then stick themselves onto certain immune cells, mainly mast cells and basophils. They just sit there, waiting.
Like little landmines.
Kind of. Then, the next time you encounter that same allergen, it binds to the IgE already stuck on those mast cells, and boom. The mast cells basically explode, releasing a flood of potent chemicals. The most famous one is histamine.
Ah, histamine. That's the culprit behind the sneezing, the itching, the runny nose, maybe hives, all that misery.
Histamine is a huge player, absolutely. It makes your blood vessels leaky, irritates nerves, causes tissues to swell up. All those classic allergy symptoms stem from that massive release triggered by IgE and the allergen. It's an over-the-top reaction.
Okay, so that's the system shrieking out about something from the outside. What about autoimmune disorders, where the system turns on the body itself? That seems like a much deeper glitch.
It really is. It happens when the immune system loses what we call self-tolerance. It can no longer reliably tell the difference between self, your own body's tissues, and non-self, the invaders.
It attacks friendly forces.
Exactly. It mistakenly identifies parts of your own body as foreign and launches an attack. The sources you gave us provide a really good, detailed example. Lupus. Specifically, systemic lupus erythematosus, or SLE.
Right, lupus. I know it could affect so many different parts of the body, skin, joints, kidneys, even the brain. How does one immune problem cause such widespread havoc?
That's where understanding the pathophysiology, the step-by-step process described in your sources, is key. It starts because the immune system somehow loses that self-tolerance. Why isn't totally clear, but it starts producing autoantibodies.
Autoantibodies.
Yep.
Antibodies against yourself.
Precisely. Antibodies directed against your own cellular bits and pieces. The sources specifically call out things like anti-dsDNA antibodies, antibodies against your own DNA, and anti-Smith antibodies. These are almost like diagnostic markers for lupus.
Wow, attacking your own DNA. That sounds bad.
It is. And here's the critical step that explains why lupus hits so many places. These autoantibodies find their targets in your body and bind to them, forming what are called immune complexes.
Okay, complexes, clumps.
Yeah, basically little clumps of antibodies stuck to self-antigen. Now, these complexes don't just stay put, they circulate in your bloodstream, and they can get lodged or deposit in various tissues all over the place. Tiny blood vessels in the skin, the filtering units in your kidneys, the lining of your joints, you name it.
So it's the traveling and dumping of these immune complexes that makes lupus affect multiple systems.
That's the core idea, yes. Where these complexes happen to settle determines which organ gets hit. And once they're deposited, they activate another part of the immune system we touched on earlier, the complement system.
Complement.
Usually helpful, right? Normally, yes, it helps clear infections. But here, when it gets activated like crazy by these deposited complexes, it causes a cascade of inflammation and damages the tissue right where those complexes landed.
Ah, I see.
And because this deposition can happen in lots of different places, you get that characteristic multi-system involvement of lupus.
That makes sense why the symptoms can be so incredibly varied then. What are some of the common ones the sources point out?
They really paint a picture of that widespread impact. General symptoms, often things like really profound fatigue, fevers that come and go.
Yeah.
Musculoskeletal issues are very common, joint pain, swelling, like arthritis.
Yeah.
Skin-wise, the classic butterfly rash across the face is a telltale sign for some.
The Miller rash, right?
Exactly. Or just being unusually sensitive to sunlight photosensitivity. Kidney involvement, lupus nephritis, is a serious concern. Some people get neurological symptoms, cognitive fogginess, sometimes seizures. Lungs and heart can be affected with inflammation of the linings. Blood problems, too, like anemia or low counts of other blood cells. It really depends on where those complexes settle.
A disease with many masks. Are there specific lab tests that help confirm it's lupus?
Yes, the sources mention several key ones. A positive ANA, anti-nuclear antibody test, is very common in lupus patients highly sensitive.
But not specific.
Right, you can have a positive ANA for other reasons too,
Huh.
but then tests for anti-dsDNA or anti-Smith antibodies, those are highly specific for lupus. If they're positive, it strongly points towards SLE.
Okay.
Also, during flares, when those immune complexes are causing trouble and using up complement proteins, doctors might see low complement levels, C3, C4, in the blood, and general inflammation markers like ESR or CRP are often elevated too.
Okay, wow. So we've journeyed through the immune system's might, its potential for error with allergies and attacking itself in autoimmunity like lupus. Now let's link back to something you mentioned way back with innate immunity, that physical barrier, the skin, our largest organ, you said.
Absolutely. It's easy to forget, but the skin isn't just a wrapper, it's a dynamic, active organ. It's our literal front line against everything the world throws at us.
Can you give us a quick refresher from the sources on its layers and main jobs?
Sure. Outermost is the epidermis. That's the key protective barrier layer.
Right.
Below that, the dermis. It's got blood vessels, nerves, hair follicles, sweat glands. It's the thicker workhorse layer.
Okay.
And deepest is the subcutaneous tissue, mostly fat, which gives cushioning and insulation. Its functions are huge. Protection, obviously, but also regulating your temperature, letting you feel things, sensation. It even has immune cells within it, maintaining fluid balance, and helping make vitamin D from sunlight.
So what happens when this crucial organ gets damaged or diseased? How does that disrupt things?
Well, any skin disorder fundamentally messes with those layers and functions. It could be inflammation, like an eczema or psoriasis. It could be infection breaking through the barrier, trauma, burns, or even autoimmune attacks on the skin itself, like in pemphigus.
Uh,
Whatever the cause, the integrity of that barrier gets compromised. The sources also mention that understanding how skin normally heals through phases like inflammation, then proliferation or rebuilding, then remodeling is really important. Because many skin problems involve healing gone wrong or just way too much inflammation.
the sources gave some specific skin issues as examples.
They did, yeah. Good illustrations, like pressure injuries, sometimes called bed sores.
Right.
They happen from prolonged pressure or shear or friction, usually over a bony spot, cutting off blood flow and damaging the skin and maybe deeper tissues. The sources talk about staging them from stage 1, which is just persistent redness, up to stage 4, where you might see muscle or bone.
And tools to predict risk.
Exactly, like the Braden scale. It helps assess someone's risk so care can be proactive, preventing them is key.
Burns seem like an even more dramatic loss of that barrier.
Oh, absolutely. Burns just destroy that skin barrier, depending on the severity. That opens the door wide to infection and massive fluid loss hypovolemia.
That sounds dangerous.
It can be life-threatening. The sources touch on the different phases of burn care: emergent, acute, rehab, and treatments like skin grafts. Using your own skin from another site, that's an autograft. Using donor skin temporarily is an allograft.
Okay.
And also different methods of debridement, getting rid of the damaged tissue so healthy tissue can grow.
And circling back to our immune chat urticaria, or hives, that's the skin showing that type of hypersensitivity again, right?
Perfect example. Hives are a classic IG reaction right there in the skin. An allergen triggers mast cells in the skin. They release histamine and up pop those itchy welts.
And psoriasis sounds more like an autoimmune problem focused on the skin itself.
That's right. Psoriasis is a chronic autoimmune condition. The immune system mistakenly tells skin cells, keratinocytes, to grow way, way too fast.
So they pile up.
Exactly, leading to those thick, red, often silvery scaled patches or plaques. Treatments often involve calming down that specific immune attack on the skin: topicals, UV light, sometimes immunosuppressants, or those newer biologic drugs.
And the sources mention some other common skin issues too.
Yeah, important ones. Things like skin infections, cellulitis is a common one, a bacterial infection getting under the skin, causing redness, warmth, swelling.
Okay.
And then things like skin trauma, cuts and scrapes, but also skin cancer. The sources specifically mention melanoma, which is serious, and remind us about the ABCDEs for checking moles.
Right. Asymmetry.
Border irregularity, color variation, diameter bigger than a pencil eraser, and evolving or changing. Really practical advice for everyone.
Okay, this is a huge range of issues. Internal immune battles spilling over, external barrier breaches, sometimes both happening at once. Moving towards managing all this, how do healthcare teams approach these complex conditions? What does care look like?
Well, The sources really stress that managing these kinds of conditions, immune system issues, complex skin problems, absolutely requires collaborative care. It's not a one-person job.
A team effort?
Definitely.
Okay.
You need an interprofessional team. Think allergists, immunologists, dermatologists, obviously, but also pharmacists managing complex meds, nutritionists because diet matters, social workers or counselors dealing with the emotional side.
Wound care specialists if needed.
Right, wound care specialists for things like pressure injuries or burns, and the primary care provider often acting as the coordinator. Their goals aren't just, fixing the rash or stopping the allergy attack. It's about overall healing, preventing infections, managing pain, making sure nutrition and mobility are addressed, and providing that vital psychosocial support.
It sounds like preventing problems, or at least catching them, early risk reduction, must be a huge focus too.
Oh, absolutely essential. The sources talk about different levels of prevention. Primary prevention is trying to stop it before it even starts.
Like avoiding triggers.
Exactly. Avoiding known allergens or triggers, living a healthy lifestyle, good diet, hydration, sleep, getting vaccines, quitting smoking, using sunscreen SPF 30 or higher, daily, basic hygiene.
Okay.
Secondary prevention is about early detection, maybe allergy testing if you have symptoms, regular skin checks. And tertiary prevention is for when you already have the condition, managing it to prevent flares, complications, or worsening.
So taking your meds consistently.
Right. Taking meds, maybe doing daily skin inspections if you're at risk for pressure injuries, really strict allergen avoidance if your allergies are severe, that kind of thing.
What about the actual treatments? What's in the toolbox?
It's pretty varied, depends on the problem. For allergies, you've got antihistamines blocking histamine, maybe nasal steroids, sometimes immunotherapy allergy shots to desensitize the immune system over time.
Okay.
For inflammation, corticosteroids are workhorses, creams, inhalers, pills, injections, lots of forms. For autoimmune diseases, you might need stronger immunosuppressants like methotrexate or increasingly those targeted biologic drugs.
Right, the newer ones.
Yeah. And critically, for severe life-threatening allergic reactions, anaphylaxis, having an epinephrine auto-injector, like an EpiPen, readily available is absolutely vital.
Life-saving.
Totally. For skin problems specifically, you'll see antibiotics or antifungals for infections, and really important emollients or moisturizers to help support and repair the skin barrier. And don't underestimate non-drug approaches like stress reduction. Stress can definitely trigger flares for both immune and skin conditions.
You mentioned the emotional side earlier. It seems like these conditions would take a significant toll, mentally and socially.
It's a huge point the sources emphasize. The psychosocial impact can be massive. Visible skin issues, that can lead to serious body image concerns, anxiety, depression, feeling isolated.
You can imagine.
And living with something unpredictable like lupus, the constant worry about flares, the fatigue, it's incredibly stressful. So management has to include emotional support, connecting people with support groups, teaching coping skills, getting family involved, maybe formal counseling. It's treating the whole person.
And pulling all these threads together requires good assessment and coordination.
Right, absolutely. Assessment starts with listening a good history, then the physical exam, then labs IgE levels, those autoantibodies we talked about, maybe skin biopsies or cultures, and then care coordination and transition management become key. Especially if someone's moving, say, from hospital back home or seeing multiple specialists. It's about organizing follow-ups, setting up home care if needed, making sure prescriptions are filled and understood, addressing needs for school or work accommodations, and keeping everyone on the team updated. It's the logistics of good care.
Which leads to a really critical issue the sources bring up. Health equity considerations. Getting this kind of complex, coordinated care isn't equally easy for everyone.
This is a massive challenge, and the sources rightly flag it. There are real barriers. Cost is huge. Those biologic drugs can be incredibly expensive. Access to specialists might be limited by insurance or just geography, harder to find in rural areas. Transportation to appointments can be a hurdle. Health literacy is another big one, making sure people truly understand their condition and treatment plan. Using plain language, using teach-back methods.
H-back.
Yeah, asking the patient to explain it back in their own words to make sure they got it. Plus, cultural competence, respecting different beliefs, and language access, providing interpreters when needed. It's about recognizing these barriers and actively working to overcome them, advocating for patients, and tailoring education.
Wow. Okay, we have covered an incredible amount of territory today. For the body's own defense forces, the innate and adaptive immune systems, to how they can sometimes glitch, causing allergies or turning against the body in autoimmunity like lupus, then linking that to our vital outer shield, the skin, and its own challenges.
Yeah.
And finally, looking at the really complex team-based approach needed to manage all this, including those very real-world equity issues.
It really does give you a deep appreciation for how intricate the body is, doesn't it? It's resilience, but also all the ways things can get thrown off balance. Understanding these layers, from immune cells to skin barriers based on the material you provided, paints a pretty full picture of health and disease.
Absolutely. So as we wrap up, thinking about everything we've dug into, the rapid responders, the memory cells, the histamine explosions,
Yeah.
the immune complex deposits, the skin barrier breaches, what's the one thing that really stands out to you from this deep dive? How does understanding these hidden fights and visible vulnerabilities maybe change how you think about everyday health challenges?